Welcome back. The number of Mpox cases recorded in the country has risen to 7, with 2 deaths recorded. The latest case is a 39-year-old man from the Western Cape. The other infections are in Gauteng as well as KwaZulu-Natal. Now, all patients are males aged between 30 and 39 without a travel history. The health department has also urged members of the public to go to their healthcare facilities if they experience any symptoms, which includes a rash or fever. Let's now speak to SA Medical Association chairperson, Dr Mvuyisi Mzukwa. Dr Mzukwa, a pleasure to have you on the program this afternoon. Thank you for joining us. So, with the recent announcement of the new Mpox case and the second death linked to this disease, how concerned should the public be about the Mpox at this stage?
Good evening to you and to your viewers, and thanks for having me in your program. Yes, it is a little bit worrying that we are getting cases of Mpox in the country, and obviously there are deaths. But I must say that there is no reason to panic. Though we should be, alert as to what is happening around us. We should know that there's a virus in circulation and is causing problems with people with underlying medical conditions. And you can see, it was reported earlier, I think in May, some of these cases where you find that people have been infected, but the rate of infection is not as fast as what we have seen in other viruses like COVID. But that doesn't mean that we should let our guards down and not be cautious of what is happening around. So we need to obviously be concerned that there are people who are dying from this, and also take the necessary precautions.
And let's speak more about this. Can you explain what Mpox is and how it is transmitted? And also, what are the key symptoms that people should be on the lookout for here?
Well, Mpox is what used to be called monkeypox virus. And it's now called Mpox. Now, you'll recall that there was an outbreak at around 2022 all over the world, around more than 100 countries, actually, and in all 6 regions of the World Health Organizations. And you recall what happened is that those cases, when you get Mpox, you get a painful rash. It usually comes out of your palms, of the soles of your feet. It also would cover your face and the whole body. But also you may have headaches, fever. You could also have swollen glands in the neck and stuff. And also you could have generalized body pain, including joint pain and muscle pain. Those are the signs that you should be expecting. And obviously, if you have that, you need to seek medical attention.
So the latest patient had extensive lesions and other severe symptoms. Could you elaborate on why some cases of Mpox are more severe than others, and what factors contribute to the severity?
Well, ordinarily, you don't find severe cases of Mpox, and they don't necessarily, in most cases, lead to fatality, unless, of course, there are underlying medical conditions. And in that case, is usually with people who may be immunocompromised. And by immunocompromised, we're saying that those people may have, poor functioning immune system. And that could be caused by the conditions that they have. But in most cases, you'll find that those people are on medication and they've not been following up on their medication, not adhering to their medication, and making it worse, so that they become vulnerable to any condition, including Mpox. Hence, with the Department of Health, we urge everybody who's on chronic medication to really adhere to medication, take medication accordingly, so that they are protected in this regard. But also, if you are found to be having a condition like this, you need to isolate yourself, but at the same time, you need to seek medical attention so that you don't spread the condition to other people around. So the issue is there must be an underlying medical condition. And even if you follow on the cases that have been picked up in South Africa, there are underlying medical conditions. Most of those people are immunocompromised.
I want to ensure that we understand you correctly, and also considering that the recent case involved a patient living with HIV, how does Mpox then interact with these pre-existing conditions such as HIV? Are individuals with the compromised immune systems at higher risk here?
Yes, I think we need to clarify this. Not every HIV patient would die from Mpox. It is usually people with very low CD4 count, and that could be caused by the fact that perhaps they are not taking their medication, and that is causing the viral load to go up and the CD4 count to go down. So usually that to be immunocompromised come from that angle. But you'll understand that most of the patients who are HIV positive or people who are HIV positive, they are taking their medication, their CD4 count is usually high, and they usually don't have problems.
Yeah.
But those fewer ones that are not taking their medication due to whatever reason are the ones that you find, catching this Mpox and experiencing such severe symptoms when they catch the virus.
I want to take the remarks of the Health Minister, Dr. Joe Phaahla, who emphasized the importance of personal hygiene and also early diagnosis. What specific practices can people adopt to then reduce the risk of contracting Mpox?
Well, the important thing is that, if you start feeling symptoms, whether you think it's just ordinary flu or whatever the case is, you do obviously need to isolate yourself. You could also use your mask, making sure that people around you are not affected, but also a washing of hands, hand hygiene, and all these other things are very important, or even using a sanitizer. But importantly is that if you find that you are developing this painful rash, is that you need to isolate yourself, but not only that, but you do need to go to a healthcare institution or establishment where you get medical attention, so that you don't spread the case to these symptoms or these cases to other people.
Dr. Mzukwa, the government is investigating the latest case in collaboration with provincial health departments. But what steps are typically involved in such investigations, and how do they help in really controlling the spread of this disease?
Well, what happens is that there's usually a contact tracing. If you've got a case, you need to know where this person is coming from, all the journey, from home to hospital, whatever, which are the people who were involved and how much time was spent with that person, and you follow up on those, making sure that, if there are symptoms, they are isolated and stuff like that. So there is a team that must be in place. And I think the Department of Health so far is doing very well, to address this issue of contact tracing. And I think as communities, we need to work together with the department so that we don't, this doesn't get out of hand. But so far, the important thing is that if you have symptoms, avail yourself, be known by the healthcare institutions, by your clinics, by your doctors, and everybody else, so that there's that contact tracing and testing that is done by the institutions.
So Mpox is said to be preventable and treatable if diagnosed early. Could you outline the current treatment protocols and preventative measures in place for Mpox in South Africa specifically?
Well, you'll recall that this is not it was not a widespread condition in the country. So medication, antiviral medication that is treating this virus, it has to be, they have got to get it from other countries, including if there's a need to go on a mass vaccination. It has to be a decision that is taken by the department. But obviously, they are getting that medication from outside, to the country. Like you said, Mpox is self-limiting, but also it can be treated. There is specific treatment for that an antiviral that is used to treat Mpox is a treatable condition.
So with only 7 confirmed cases and 2 deaths over 5 weeks, how does Mpox compare to other infectious diseases, Doctor, in terms of transmission and also the mortality rates here?
Well, the mortality rate is very low. For example, I think it was since 2022 up until now. I think that's if you compare all the countries, the estimated rate of death was about 185 patients. So, and usually those patients, like I said, are immunocompromised. But the transmission rate is very slow. But also, the death rate is sitting at about 5.5%. So it's a very slow virus. And like I said, treatable, but also self-limiting. But that doesn't mean that we must be careless and not take the necessary precautions, especially if we get a warning from the Department of Health like this. We should be, all of us, taking it very seriously.
So, as the chairperson of the SA Medical Association, Dr. Mzukwa, what message would you like to really drive or convey to the public regarding this Mpox, and also measures being taken to ensure that public health and safety is actually ensured in this country?
First of all, I think we need not panic. That's the first thing. The second thing is that as communities, we need to be aware of the symptoms, like I outlined earlier on. We need to be aware of symptoms. If you have those symptoms, you do need to go to a healthcare establishment, whether it's a clinic or a hospital next to you or a doctor next to you. But you need to medical attention. But also, you need to isolate yourself in terms of trying to avoid contact with your families, immediate family, your neighbors, everybody. Like tomorrow is church. I don't think it's not wise to go to church when you are symptomatic, whether you've got flu or whatever the issue is. If you are sick, you need to isolate yourself, get the necessary medical attention, and then you protect the communities around you. The important thing is that we need to wash our hands all the time. We need also to put on a mask if we are coughing and stuff like that, especially because it's now a flu season. It's not only about Mpox, it's other flu viruses as well that are in circulation as we speak.
Dr. Mvuyisi Mzukwa, thank you so much for your valuable insights on Mpox and the steps we can take to protect ourselves.